Welcome back to my channel, guys. I hope you are all good, and after a really long time I'm back with this one new video where I'll be sharing some photos that will be very useful in your ophthalmology spotters. And every day I will be just sharing like 2 to 5 photos, and then I'll be describing them, all those things that you need to know for a spotter, and that's it. So I just thought of sharing whatever I'm learning. So let's just get started. Okay, so the first thing here is this picture. So I think, if first of all, try yourself to interpret this picture. So what do you see here? If you ask me, then I can see some redness. I can see redness in the eye. I can see a kind of, like an ulcer, a kind of scarring like here, and I can see there's something settling down. Okay, so what it is? Can you just name it? First, try yourself to name it. If you're not able to, then we will definitely go back to the next slide. So this is hypopyon. Okay, so the term hypopyon is used to describe a milky white fluid level in the inferior part of the anterior chamber. When the exudates are heavy and thick, they settle down in the lower part of the anterior chamber as hypopyon sterile pus in the anterior chamber. Okay, and it can be sterile in bacterial corneal ulcer and not sterile in fungal corneal ulcer. And you have to know why hypopyon is known as sterile pus, because it occurs due to the release of toxins, not by the actual invasions of pathogens. The toxins secreted by pathogen mediate the outpouring of leukocytes that settle in the anterior chamber of the eye. Hypopyon can present in educativity. You can be asked to like corneal ulcer, Bessy disease, and in endophthalmitis and panophthalmitis. So I'm so wrong with pronunciation. And adverse reaction of sound drugs such as rifabutin. So this is something that you should know. So it's just like there is settlement of the pus here. So I will check make some. Okay, I forgot to keep the next slide, which was of hypopyma, which is about this blood. And but now for now I just kept it. In next video I'll definitely ask you, okay, about this also, and we will compare both of them. So now the next thing is this. So can you see what it is? So please try to interpret yourself. You can see this round big like nodule kind of thing, like a mass in the upper lid. So maybe some of you have already got the answer. So now let's go to the answer. The answer is chalazion. What is a chalazion? Chalazion is the eyelid. It happens when the eyelid oil gland clogs up. So we know that there are like 25 to 30 glands in our eyelids, upper and lower eyelids. So when there are such amount of gland, whenever some of those glands produce oil, okay, some of these have other functions. So what happens is, when the eyelid oil glands clogs up, it starts at an internal hordelum style. Okay, at first you might not know you have chalazion and little or no pain, but as it grows, your eyelid may be red, swollen, and sometimes tender to touch. If the chalazion large, it can press on your eye and cause blurry vision. Okay, it is also called tarsal or meibomian cyst, as you said, meibomian gland. So it's a congestion of that. It's just when it gets clogged up. It is also called chronic, non-infective, non-suppurative lipogranulomatosis inflammation of the meibomian gland. So this is I took out from this ophthalmology book of A.K. Khurana. So there is this definitions. It's helpful, if you study the definition from book. So symptoms, there you will get painless swelling, mild heaviness, blurred vision, watering of the eyes. Obviously, whenever you have something open on your eyes, I think you can just relate with the symptoms and signs. There's nodule, there's reddish purple area. And for treatment, you can write about conservative treatment in the form of herb fermentation, topical antibiotic eye drops, and oral anti-inflammatory drugs. Okay, and the next thing that you can do is incision vertical on the posterior surface of the eyelid, and drainage, incision and curettage, intralesion steroids like triamcinolone injection. So this is only the things that you have to study. I am not explaining them in detail because it's a spotter video where I'll be showing some photos, and I'll be just giving you a few descriptions and points that you should be remembering from there. And I will make a separate video for each of this topic, explaining them in brief. Okay, so now let's go to the question number 3, and this is this. Okay, I think most of you have totally guessed it. If you have studied
chalazion, you
will definitely know what this is. So let's see how many of you will be able to guess. Okay, now let's move to the description. So this is a hordeolum. Okay, I call it hordeolum. I don't know if this is the correct pronunciation or not. So it is a small red painful lump that grows from the base of your eyelash or under the eyelid. Okay, most styes are caused by bacterial infection. Okay, and these are two kinds of stye, that is external and internal. So this is the internal hordeolum, okay, inside the eyelids, and this one is the external hordeolum. Okay, a stye that begins at the base of the eyelash. Most are caused by the infection in the hair follicle. It might look like a pimple. Okay, internal hordeolum, a stye inside your eyelid. Most are caused by infection in an oil producing gland in your eyelid. So I don't know if you have read here or not, but this how you
chalazion,
differentiate between chalazion and hyaluron. So one thing that you have to remember is this painless swelling. Okay, a chalazion has a painless swelling. Okay, it has a, okay, what colors will I use to highlight it? Okay, it always has a painless swelling, whereas the hordeolum has a painful swelling. Okay, it is very painful. So this is one of the very important thing that you should remember. And here is a basic comparison between external hordeolum, internal hordeolum, and chalazion. So I have also got this from one of the very popular book, and from the short medical ophthalmology book. So it is the suppurative inflammation of Zisa gland. Okay, and it is a suppurative inflammation of Hypopyon gland. As I said that there are lots of glands in our eyelids, so one of them is Zisa gland, one of them is Hypopyon gland, and
chalazion also
lipogranulomatous inflammation of Hypopyon gland. This occurs through because of aureus. It is not aureus, it's aureus. It also occurs to Staphylococcus aureus, but it is non-infective. Okay, so it is due to the what, when it gets clogged up. So this usually occurs when there is infection, there is infection through the bacteria, but this occurs whenever there is the congestions in the glands. Swelling, pain, and pus points at the lid margin. Swelling, pain, and pus points away from the lid margin. This is non-infective, so there is no pain, nothing like that. So you treat it by hot compression, topical and systemic antibiotic, epilation, hot compression, topical and systemic antibiotics, and here you give incision acuitas, interlesion steroids, no? And if there is recurrence, that indicates the chances of sebaceous cell carcinoma. So this was all. Okay, I want to make this video really short and sweet, so it is totally exam oriented. I'm not explaining them in brief. If you want it, I can definitely make videos on each of this topic and explain you there. For now, only this much. I hope you like this video and this topic, and please share it among your friends, and do like, share, and subscribe to my channel. I really need your support to grow up. Thank you so much. Bye.